Here is MRI IAM on 40-year-old with history of left-sided tinnitus. I'm showing Sys3D sequence. What we have got here is normal 7th and 8th cranial nerves. And you can see the looping blood vessels which are on both sides extending into the mid-thirds of both internal acoustic canals. So I would document this in my report, but after that I usually put these sentences after I mention the looping blood vessels. I write, although crossing of blood vessels is considered as one of the causes for tinnitus, there is poor correlation and MR findings are usually neither considered sensitive nor specific. A loop of anterior inferior cerebral artery usually enters the ISE in 20 to 40% of individuals and is generally of no or little clinical significance. So I write this standard sentence after I make note of the looping blood vessels. What is another finding we have got? We have got very, very prominent left transverse sinus, and as we come, the jugular bulb is very, very prominent. So I usually make note of this, especially when there is history of left-sided tinnitus with a left-sided prominent jugular bulb. The way I report that is a prominent left jugular bulb is noted, which is a normal variation. A prominent left jugular bulb does not necessarily mean dehiscent jugular bulb, but can be associated with it. In view of symptoms on the same side, CT Petrus might be worth considering to look for any dehiscence of the jugular bulb to explain the tinnitus. So that is what I would write whenever I find a very prominent jugular bulb and tinnitus is on the same side.